urinary system is composed of the kidneys, ureters, bladder, and the urethra. The kidneys act as a filter and remove urine from the blood. The ureters carry the urine from the kidneys to the bladder, where it is stored and emptied through the urethra. Normally, urine is sterile and free of bacteria and viruses. Bacteria can enter through the urethra, however, and cause an infection along the urinary system, causing a urinary tract infection. Symptoms of an infection could include a burning sensation when urinating, passing small amounts of urine often, and blood in the urine. If the infection isn't detected and treated early, it can spread to the urethra, the bladder, or kidneys. Your kidneys, located in the back of your torso near your lower ribs, are responsible for filtering your blood and producing urine. Blood enters the kidneys through the renal arteries and then branches into smaller arterioles, which lead to individual filtering units called glomeruli. If a renal artery becomes narrowed due to injury or disease, blood flow to the glomeruli will be reduced, and the tiny arterioles will sense a decrease in blood pressure. When this occurs, cells that line the arterioles release chemicals into the bloodstream. These chemicals make their way to the general circulation and cause arterial constriction all over the body. The arterial constriction increases blood pressure above normal and may lead to damage to several organs, including the heart and the lungs. The kidneys are a pair of small, kidney bean-shaped organs. They are located towards the back of the body, behind the lower ribs. Although we are born with a pair of kidneys, our bodies can still function efficiently with just one healthy kidney. The kidneys filter urine from the blood, balance the body's fluid content, produce hormones that control blood pressure and make red blood cells, and activate vitamin D to maintain healthy bones. The kidneys can become damaged and unable to function normally because of uncontrollable high blood pressure, infections, or because of complications from diabetes. A kidney transplant may be recommended to replace the damaged kidney with a healthy donated kidney that is attached to your blood vessels and bladder. The donated kidney can come from a live donor or a recently deceased donor. As with any transplant, rejection of the new kidney may occur if the body's immune system tries to fight against it. Our bodies have two kidneys that are located at the base of your ribs in your back. Their main job is to filter blood for the removal of waste products like urine. Urine travels out of the kidneys and into the ureters that connect to the bladder. Sometimes a mass forms in the collection part of the kidneys. That mass is a kidney stone, which is a combination of calcium and uric acid found in urine. Many people pass small kidney stones without knowing it, but larger stones can be very painful as they move through the ureter, into the bladder, and out of your body. The kidneys are a pair of small, kidney bean-shaped organs. They are located towards the back of the body, behind the lower ribs. The kidneys filter urine from the blood, balance the body's fluid content, produce hormones that control blood pressure and make red blood cells, and activate vitamin D to maintain healthy bones. Some diseases, birth defects, or injuries can damage the kidneys, leaving them unable to function normally. When 85 to 90% of your kidney function is lost, that is called end-stage kidney failure, and dialysis is recommended. Dialysis replaces the work of the damaged kidneys by using an artificial kidney machine or hemodialysis. During this procedure, access to your bloodstream will be made. Your blood will leave your body and travel through a special filter called a dialyzer, where waste and extra fluids are removed. The cleaned and filtered blood will then travel back into your body. Hemodialysis is usually performed 3 times a week and can be used as an ongoing treatment until the kidneys resume their function or until the patient receives a transplant. The bladder is an organ whose function is to collect, store, and release urine. It is part of the urinary system, along with the kidneys, ureters, and the urethra. The kidneys remove liquid waste from the blood in the form of urine. The urine travels through the ureters to the bladder and is emptied through the urethra. A bladder infection occurs when bacteria enters the urethra and bladder, causing inflammation and infection. Symptoms may include the frequent need to urinate and pain and burning during urination. Antibacterial drugs are used to treat a bladder infection. However, if not diagnosed early, the infection can spread to the kidneys as well. Our urinary system is made of 2 kidneys, 2 ureters, a bladder, and a urethra. The kidneys remove waste products from the blood and form urine, which travels through the tube-like ureters and is stored in the bladder. It's easy to think of the bladder as an upright balloon. When the bladder is full, urine flows through the urethra and out of the body. A lack of bladder control can be caused by a combination of conditions. But one cause for incontinence may be a weak sphincter muscle that lies at the base of the bladder. Normally, the sphincter muscle contracts and expands according to your body's need to urinate. If your sphincter muscle is weak, muscle control is compromised, and leakage can occur. Your doctor can prescribe an appropriate treatment according to the severity and cause of the incontinence.